Dear friends, today once again I am happy to meet you on this Saturday, 13th September 2025. We have completed 1621 cases. So every day we are going ahead. I am thinking how I got the idea of treatment of puberphonia. So my mind is going back. God is helping me to a great extent to do research, innovative work on puberphonia. So, what are the things I am doing? It is a gift of God I am feeling. This day, I just thought, what are the things I have done in my life? My life, my story, my research. What are the things I want to share with you on this day where I have completed 1621 cases of puberphonia on this Saturday, 13th September 2025. What are the original work I have done? Yes, definitely the puberphonia, what I am treating is my original research work. Nobody had taught me to do that. Nobody is doing also in this world this procedure. What my procedure I am doing in the world is my own. This is what my advocate advised me today. You boldly tell it is your own research work. How can I am the little hesitating in the world? I am the only person doing that work. How can I tell? Somebody, if they are doing, let them tell. I have got a recognized world record saying that I am the only doctor who has seen more than 1,600 cases of puberphonia and treated. A single doctor who has treated. But openly telling, this is my own innovation. I have developed my own idea. First day itself, I will get the voice. What is they require? 5 days treatment means habituation. That I tell them few exercise they have to do it. Personally, they have to do the exercise. I will teach them. This is what I am doing. So how I found out this original work? My original research work was very small, but now I have done a breakthrough in the history of ENT. When I put what is the contribution of India to the treatment of puberphonia, if I put in Google, it clearly suggests Umar treatment is a breakthrough in the treatment of puberphonia, where the Dr. Kumaresan has done more number of cases of puberphonia treatment. Let anybody can say whether you have seen 1,650 cases of puberphonia and whether you have treated that. I have treated. This is what my advocate Alex telling me, you tell, you have done it. Then only the world will recognize, oh, you have done it. If you are not exposing that, how can the world know? So now I have started writing a small book, more than 200 pages, with full of 600 photos. It is carrying 600 photos. My life, my story, my researches. So I was going on thinking, what are the original my researches, original idea? What are the things I had? Thinking back, in 1992, I tried ear transplant. Nobody can imagine. I tried. I am not telling I have succeeded in doing ear transplant, but I tried in rabbit ear transplant in 1992. I transplanted cochlear labyrinth with hearing loss, a research study in 1992. For publishing that, I have written one book called as Clinical and Practical Otorhinolaryngology, in which I have published. That time, 1989, I had an animal lab in Siva ENT Hospital. I had a separate animal lab where animal lab means with the rabbit. I transplanted it. I know it was not successful. Still, I tried. What are the effect of ear transplant? I know that. How the animal walk. What is the position of the head when they walk? Very interesting. But try to understand me. Today also I had a good research idea. Today means you may wonder. Today, 13th Saturday, September 2005, I had a small research in my mind. One of the boy, I am giving treatment freely because this is a new thing what I am doing. This boy, congenitally, he was not, he had some problems. Now he has developed a lot normal boy. His age is around 7 years. He used to tell two words or three words only. Come, go, eat fruit. Continuous sentences he is not able to make it. So this boy was brought to me, and mother is very anxious. This boy is using only two words sentences, not able to tell continuously. He is not able to. He used to tell one, two, three, but come, eat, get up. That's all. But continuous sentences he is not able to do it. Why not you give training for the boy? So I will give training. This boy is not from Chennai. He is far away from Chennai. They have to prepare and come. So he is near Tiruvannamalai. So I asked them at least weekly once you come. So they used to come in the morning and go in the night from Tiruvannamalai to Chennai. Today the boy had come. The boy is very much improved. Says full sentences. What I have done is nothing great. There are 6 boys taking treatment for puberphonia habituation. Puberphonia, I am telling truly, on the first day you will have manipulation, they will get the voice. Very simple. They are talking with vocal cord. I asked them to talk with Eula manipulation. Hello, how are you? We put a small thread in the Eula that will initiate them with abdominal breathing. Hello, hello. Why abdominal breathing is? First instruction is you have to have good amount of air to talk in the treatment of puberphonia. How abdominal breathing exercise. How to do abdominal breathing exercise? There are 10 steps for that. I will teach them. Keep the hand and feel. That are all the things you can say your abdomen is moving. But how to do it? Very simple. For asthma patient, we used to give them, if you want to have good breathing, you do abdominal breathing, not chest breathing in asthma patient treatment. Knowingly or unknowingly, asthma patient will sleep with leaning forward in the table. That is the abdominal breathing. You lean forward and breathe, you will feel the abdomen is moving. So simple treatment, simple exercise. Lean forward, breathe. You will feel you are breathing from abdomen. That breathing exercise you have to practice and continue in your life. Even on the first day of treatment, we used to continue the treatment in the night, abdominal breathing, by raising the hand or leaning forward in the table and breathe and talk. So you are having good breathing. This is one instruction. Second instruction, your voice should come through the oropharynx, nasopharynx, nasal cavity, and sinus. This should be clear. The passage of the respiratory tract should be clear. Why nose should be clear? Because you have to resonate in the sinus. Then only the low pitch produced voice will have resonation. See, what is the research I have done today? I am telling clearly today, 13th Saturday, September, I have done the research, did one research. That is, this boy's mother came and tell me, now this boy is talking with animals. Boy is talking with flowers. Boy is talking with plantation. I am now talking. I am fully aware of what I am talking. I am going to eat fruits. I have taken the drinks, Coca-Cola. I have taken the coffee, milk. Continuously, he used to talk. To whom? With animals, cow, with birds, with the tree. I have experimented it. I have taken photos. If you want, I can share the photos. He was gladly talking with tree in my hospital veranda. I had a tree. So I asked to go to the tree and talk. He was talking continuously. Small boy is talking continuously with the tree. He was happy. This why I am have done this research today in my mind. I am telling you, I went 40 years back for a ENT conference, not 40, 20 years back to Hungary, Budapest for ENT World Conference, where I have presented a paper on rhinospodiosis and a photo show, the third world diseases. So I went to Hungary, where I had the experience of boys talking with trees. The great ambassador of India in Hungary, he had given a party to us in one evening. We 17 doctors were there in Hungary under the presidency of the great ENT surgeon Dr. Hiranandani. We were staying in Hotel Miramar in Hungary. So the great ambassador Dr. Hiranandani arranged that we around about 20 doctors had come from India for this 5 days world conference. So the ambassador had given a small get together in his house at Hungary. We went there. We had a good dinner there, and I happened to meet one Tamil cook there in the house of the ambassador. I'm so happy to see the cook. And we were talking in Tamil. He embraced me. Oh, after a long time, I'm talking in Tamil in Hungary. See, nowadays in America, London, you can see many people talking in Tamil. But when I went some 40 years back to London, nobody is there to talk in Tamil. And very rarely only in London, I am telling, very rarely only ladies have sari. All will be astonished to see a lady in sari. But nowadays it is very common. So this boy, a cook in Hungary, who is a Tamilian working in the ambassador house, see me that I am a Tamilan. He hugged me. Oh, and he was very, very happy to talk in Tamil, 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 Tamil. Don't mistake me. I asked him, why you are so excited in seeing me? No, he told me, now only I am able to talk and exchange my views openly. I know Hindi and other languages because I am working in a Ambassador House. Then how you talk with Tamil? He told me he used to talk with the trees, animals, birds in Tamil language, and they move the head, they move the leaf when I talk. The same thing this boy told me. If he talked to the animals, birds, and trees, they move their head. See, it is not a story. This is what really happened today. If I don't know, you are able to understand what I am telling. So many years back, I went to Hungary, met a Tamil cooking boy. He was excited to talk with me in his own mother tongue Tamil. When somebody is not available, he used to talk with the animals, birds, and tree in Tamil language. They move their head. They move their head. Animals move their head. Animal recognize the voice. Birds recognize the voice and respond to the language what he is talking. That's what he says. The tree moves. That I have seen in my own eyes. This boy today he has talked with the tree which is there in my hospital. It moved. See, it moved because of the air. But whatever maybe this boy says, this tree, the leaf recognized my voice. He is very happy, innocent boy. It is difficult to believe, but this is what happening. How my mind enjoy the small boy's story. This I will publish it in my WhatsApp, in my uh, mail, in my Facebook, everything. How this boy is talking with the tree. This is something wonder. So tomorrow I am, or within a week, I am going to publish one big book, 200 pages. What are the researches I have done? What are the research I have already done? Now I am doing research on Puberphonia that my advocate told you tell it is your innovation and you have completed 1,650 cases. It is your own innovation, you tell. No, how can I tell, sir, my own innovation? Yes, you tell them somebody had done it. No, I'm sure nobody has done it. You tell whether somebody has taught you. No, 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 nobody has taught me. See, when I was doing this research, really I'm telling, Dr. Majumdar, a great man, a ENT surgeon from Pondicherry, he told me, your thing is looking like old Dravidians, what they are telling. He told me. Then he asked me, why not you come to Pondicherry? I will enlighten you. Somehow I have not gone there to meet him. What is his idea? I don't know. So if I expose what I have done, what I have invented, many people will tell, oh, I know that, I know that, I know that. So I never want to expose what is my innovation. I want to tell the people how I did EULA manipulation. In my book, I want to give that. But I am so sure with my conscience, nobody has taught me this procedure. It is my own innovation. this innovative work nobody is doing in the world, and nobody in the world ENT surgeon had seen 1,650 cases of puberphonia. So I got the world record certificate, a single doctor who had seen and treated 1,650 cases of puberphonia, a novel approach he has not told. He says the record, this single doctor seen. I am boldly telling, this is what my advocates say. You boldly tell, you are doing it. It is your own innovative work. If somebody is interested, let them tell whether they are doing and let them prove. I am having proof of 1,621 cases of puberphonia because the leftouts are there more than 100. What I am telling is, before uvula manipulation, I did a direct endoscope and treated, which was published in my book, a research on otorhinolaryngology, Stanscope. So many books are there. That is not there in this record. This record had come only after few ENT doctors suggested every case you put the number and change. So this is the record. Reason only. Reason means 5 years. Before that, I am doing it for the 29 years Puberphonia treatment. Thank you. Great. We'll try to meet next Saturday, same time. Happy, happy, happy.